Hi guys, today we will be discussing about hemimelia. Hemimelia is partial or complete absence of distal half of a limb. There are various types: fibular, tibial, ulnar, and radial hemimelia. Uh, Radial hemimelia is congenital absence of radius bone in the forearm, which is characterized by partial or complete absence of radius. Epidemiology: 1 in 30,000 to 1 in 1 lakh births. Usually, male child is more affected than female. Regarding embryology, uh, upper limb bud usually develops by the end of 4th week, that is 28 days. So hemimelia happens sometime after 28 days but before 26 days, before 56 days. Cause there is no accurate cause of accurate pathophysiology is not understood yet, but there are various hypotheses which include uterine compression, vascular injury, and drugs like cocaine. Regarding classification system used, it is Haeckel classification of radial dysplasia. There are four types of radial dysplasia, in which the type 1 is short distal radius where there is only mild hypoplasia. In type 2 there is hypoplastic radius, there can be absent thumb, there is also associated ulnar shortening. In type 3 there is partial absence of radius where radius is severely hypoplastic, there is absent scaphoid, absent thumb, and also special feature of type 3 is there is ulnar bowing, which is very obvious, and the bowing is usually towards the side of the affected limb. If radius is affected, then bowing will be on the radius side. If ulna is affected, then bowing will be on the ulnar side. In radial hemimelia, it's on the radial side. Type 4 is complete absence of radius. There are absent scaphoid bone, and thumb, hand, and wrist can also be absent along with absent radius. There are various syndromes which are associated with radial hemimelia. One such syndrome is Holt-Oram syndrome, in which it is an autosomal dominant disorder. Gene involved is TBX5 gene. It is a combination of upper limb anomalies and congenital heart defects. In upper limb anomalies, there can be radial or thumb aplasia, hypoplasia, or fusion. In the image shown, there is thumb hypoplasia. Also, it is associated with congenital heart disease, in which atrial septal defect is the most common congenital heart disease, followed by VSD and aortic coarctation. Also, Holt-Oram syndrome individuals can have phocomelia and clavicle hypoplasia, which are shown in the image. In first image of X-ray, there is bilateral clavicle hypoplasia. There can also be associated aplasia, where there won't be any clavicle bone, which is called as cleidocranial dysostosis. Phocomelia is also called as seal-like limbs. It is a important differential diagnosis for thalidomide embryopathy. Other features of Holt-Oram syndrome include brachymesophalangia, which means there is short middle phalanx, isolated. There can be clinodactyly of little finger, where there is radial deviation of the little finger. There can be synostosis of carpal bones. There can be hypoplastic carpal bones. There can be additional unnamed bones also. There can also be associated with triphalangeal thumb. So triphalangeal thumb we usually read for Diamond Blackfan anemia, but It is not an absolute condition that is exclusively seen in Diamond Black fan anime. It is seen in various other conditions. There are other congenital heart defects which include conduction defects causing bradycardia or fibrillation. This is about Holt-Oram syndrome. There is another syndrome where there is radial hemimelia, which is called as Robert syndrome. Robert syndrome is also called as pseudo-thalidomide syndrome or Robert's Focomelia syndrome. It is due to defective gene called as ESCO2 gene. In this disease, there is intrauterine growth restriction. Postnatal growth restriction can also occur. There is failure to thrive in the baby. There is thrombocytopenia, which increases the risk of intracerebral hemorrhage in the newborn. There will be sparse blonde hair, which is silver in color. There can be microcephaly. There can be hypertelorism. Hypertelorism is usually concomitantly obviates to orbital hypertelorism, which means there is increased distance between the adjacent orbits. Their other eye anomalies include coloboma, exophthalmos, cataract. There can also be facial hemangiomas. There can be midfacial cleft, bilateral cleft lip and palate, which is appreciable in this image. Then there can be prominent maxilla. Then there can be brain malformations and hypoplastic bones, and there can be also delayed eruption of permanent teeth. Skeletal anomalies, Focomelia is also caused by Robert syndrome. So this is that's why called as pseudo-thalidomide syndrome. Then there can be tetraamelia. Tetraamelia is complete absence of all the limbs, both upper limbs and bilateral lower limbs. The patients can also be associated with asymmetrical limb reduction. Oligodactyly is one of the feature where there are less bones, less of digits, and syndactyly can also be associated, which means fusion of digits. There can be flexion joint contractures. Coming to renal conditions, there can be hypoplasia, dysplasia of kidney, there can be polycystic kidney disease and horseshoe kidney. There can be associated cardiac anomalies such as atrial septal defect. There can be patent ductus arteriosus, and they can also manifest with common atrioventricular canal. Genitourinary malformations include hypogonadism, hypospadiasis. There can also be clitoromegaly and macropenis. Pardon, it's a mistake. It's not micropenis, it's macropenis. There can also be associated cryptorchidism in Robert syndrome. Also, in thoracic cavity, there can be bifid ribs, which is appreciable in this image, and this image of vertebral column shows platyspondyly, which means flattening of vertebral bodies. This can occur throughout the vertebral column. There can also be associated spina bifida along with platyspondyly. There can be maxillary agenesis and Wormian bones, brachycephaly and oxycephaly associated with Robert syndrome. This is regarding Robert syndrome. Coming to Rothman-Thompson syndrome, it is a rare autosomal recessive disease where there is poikiloderma, which you can see in image A, B, C, D, and even F. And there can be skeletal dysplasias. There can be sparse hair, eyebrows. Patients with Rothman-Thompson syndrome are usually of small stature. There can be osteopenia and delayed bone formation. So dental anomalies are also not uncommon. There can be associated cataracts in Rothman-Thompson syndrome. One important complication which you can be tested is of osteosarcoma. Rothman-Thompson syndrome patients have increased risk of osteosarcoma. Coming to TAR syndrome is called as thrombocytopenia absent radius syndrome, in which there is hypomegakaryotic thrombocytopenia, which can complicate the newborn baby for intracerebral hemorrhage. There can be absent radius, which is usually bilateral. It is an autosomal recessive condition. The special feature of TAR syndrome is of cow milk allergy. So during weaning, when the baby is introduced with cow milk and its products, the allergy can be manifested. There can be associated renal and cardiac anomalies. There can be hypoplastic jaw causing micrognathia. There can be low set ears, large forehead, and leukocytosis is a very common finding. The congenital thrombocytopenia seen in TAR syndrome is very fatal, can lead to hemorrhage, which is very life-threatening in the newborn. So that is something that one has to watch out for. Coming to Townes-Brocks syndrome, also called as Rear syndrome, in which there is renal, ear, anal, and radial anomalies. It is an autosomal dominant condition. The gene involved is SAL1 gene. Renal involvement may be polycystic kidney disease, hypoplastic dysplastic kidney, rotated malpositioned kidneys. Ear abnormalities can be abnormal ear pinna. There can be external auditory canal stenosis that can be appreciable in this image. And then there can be preaxial polydactyly. In upper limb, preaxial polydactyly means on the radial side. The polydactyly is on the radial side. Polydactyly is multiple, more than five digits. There can be hexadactyly and heptadactyly also. Hexadactyly is more common. Heptadactyly is very, very rare. Then there can be triphalangeal thumb in these patients also. The heart defects include tetralogy of Fallot and ventricular septal defect. Cataracts, coloboma, and microphthalmia are also seen. There is associated intellectual disability in these patients, and there are preauricular attacks which are common finding in Townes-Brocks syndrome. This is an image of a child with microphthalmia. There can also be anophthalmia associated, and this image A shows sentinel tags, preauricular tags. And then there is overlapping of fingers, that is also a characteristic feature that is seen in Townes-Brocks syndrome. Then treatment, one must look that there is also associated anal malformations where there is anteriorly placed anal canal opening. There can be stenotic anal canal and imperforate anus. So surgical correction should be done because external auditory canal stenosis happens. One has to treat hearing loss because a lot of patients has renal anomalies. There can be early onset ESRD and stage kidney disease, so renal transplant must be done in such patients, and surgical correction of congenital heart disease must be done. Regarding vectoral malformations, vertebral anomalies include hemivertebrae, congenital scoliosis, caudal regression, and spina bifida. Anorectal anomalies include anal atresia and imperforate anus. There can be associated cardiac anomalies and cleft lip, which can be bilateral. There can be associated tracheoesophageal fistula with or without esophageal atresia. Then there can be renal anomalies and radial ray anomalies. Other limb anomalies include polydactyly, oligodactyly. When the patient is also having hydrocephalus, we call it as vectoral H syndrome. Then there is Fanconi anemia. Fanconi anemia is a progressive bone marrow failure syndrome in which there is a predisposition to malignancies such as AML. It is an autosomal recessive condition and has more than 13 subtypes of Fanconi anemia. These patients are associated with horseshoe kidney, growth hormone deficiency, hypothyroidism, short stature, squamous cell carcinoma of esophagus, vulva, and oropharynx. There can be triphalangeal thumb in these patients also. So we have seen there are triphalangeal thumb in so many syndromes. Then there can be hepatic tumors associated along with the Fanconi syndrome along with squamous cell carcinoma. There can be scoliosis and vertebral anomalies also with absent thumb in Fanconi's anemia. So this is about radial hemimelia and associated syndromes. There are a lot of overlapping which makes differential diagnosis very important. Diagnosis of hemimelias are done by prenatal ultrasonography. Treatment includes straightening, surgeries and splints, physiotherapy to improve passive extension, polycization, osteotomy, arthrodesis and centralization of the remaining bone has to be done to maintain the stability of the limb. Earlier the surgery, better the prognosis. Polycization is a hand surgery technique where a new thumb is created by the help of an existing finger. Polycization is an amazing operation that combines surgical skill and with brain plasticity. So opposition is a very important function of thumb which is absent, and then it has to be created for smooth day-to-day activities. So this was about radial hemimelia, its associated syndromes and treatment.